Good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. Today, we will have updates from our panelists, who include Director of Public Health, Kathryn Wells, Local Health Authority, Dr. Ronald Cook, District 6 City Council Member Luttrell Joy, Lubbock County Judge Curtis Parish, and Lubbock Mayor Dan Pope. So let's start with Kathryn Wells.
Good day, everybody. I'm going to update you on our current numbers of COVID-19 cases in Lubbock County and also review some of the changes to some of our COVID clinics here in town. The health department is reporting 607 cases as of yesterday evening, May 13th. Of these, 335 are fully recovered, and we currently have 222 individuals that have active disease. The department is pleased to see the number of cases remain low each day. It has been 13 days since we have reported more than 10 cases in one day. It has also now been 2 weeks since Texas started reopening. Due to the incubation period of the virus, this is when the department would anticipate the number of cases to begin to climb. The department is cautiously optimistic as we see these low numbers, but we will continue to be staffed 7 days a week to monitor cases and conduct the crucial or critical contact tracing and investigations that we've been doing. This is all great news, but we need to make sure we continue with all of the public health measures that are working, such as limiting gatherings, practicing social distancing, and wearing a face covering when out and about. As we move forward with COVID-19 testing of Lubbock residents, this testing is really key. The department is pleased that so many partners are now offering testing in doctors' offices and in our community clinics. With this said, there are some changes to some of the testing locations and times. Covenant is transitioning their testing activities to the Covenant Medical Group clinics instead of the drive-through. The drive-through clinic that they are operating will stop on May 15th. UMC will continue to operate their drive-through clinic. It's operating 6 days a week, Monday through Friday from 8 to 6, and then on Saturdays from 9 to noon. The Walmart clinic is moving to a Monday, Wednesday, and Friday schedule, and they are running in the morning from 7 a.m. to 9 a.m. And then the City of Lubbock Health Department clinic at the Patterson Library will continue to operate on Mondays, Wednesdays, and Friday afternoons from 1 to 6 p.m. This is a by appointment only clinic, but it's open to anybody in the community, and it is free. And to set up an appointment, call the clinic or call the health department at 775-2933. Again, that's 775-2933. That's all I have for my update today. I hope everyone has a great rest of the week, and I'll turn this over to Dr. Cook.
Thank you, Kathryn. I appreciate that. What a beautiful rain that we had last night for many of us. I think we got close to about ½ an inch at our house. A little bit of hail, which always makes me nervous, but we had some good rain, and it always smells so wonderful after we have those rains. Let me reiterate what Kathryn said, and that's we must continue to maintain what we're already doing so that we can keep our COVID numbers low. We're at day 58 in this marathon, and it's literally an ultra marathon, which is longer than 26 miles. But an ultra marathon, we got to keep doing exactly what we're doing. So you got to remember to stay home if you're sick, and if you're tested, please stay home until you get your test results back. And fortunately, some of our places are able to get our test back a little sooner than others. And certainly, if you've been asked to stay home, please stay home until you finish that 10 to 14 day period. So we're doing a great job, and our numbers continue to be low. And so this is fantastic news. The other thing I want to talk to you about is the great mask debate, and this is part 2. I've already talked about it once, so this is the great mask debate, part 2. Let me show you and reiterate to you how to wear a mask. This is the one I picked up at the hospital this morning before I made rounds. It has elastic, stretchy things that go over your ears. So it goes over your nose and under your chin. This one has a little bit of band, a metal band that's soft that I can push down and make a good seal around my nose, okay? So it goes around my nose, above the bridge of my nose and below my chin, okay? It also fits fairly snugly along the cheek here. This is not how you wear a mask. Below your nose, it doesn't do any good. On your chin, it doesn't do any good. It's a nice neck warmer, but we're in the summer now, so we don't need to wear this below our chin ever. We need to make sure we have it over our nose, under our chin, and then it makes a pretty good seal along our cheeks. That's how you wear a mask. And it's really to protect others from something that I might have. When I wear this in a patient room in the hospital, like this morning on hospital rounds, I wear this so I don't give the patient something. Right now, I'm not seeing, we have dedicated providers that see patients in the hospital with COVID. They wear a much extensive set of garb to protect them and the patient so they don't get it and transfer it to each other. But if the patient's not suspected of having COVID, this is what I wear. And I wear a face shield as well. That's the mask debate part 2. That's how you wear a mask. So as we continue to open up Lubbock, our gyms are going to open up in those facilities that allow us to work out. Those places, we go there to work out. We go there to sweat. We go there to breathe heavy. We go there to get our heart rates up. And so as a result, these facilities are going to have many of the same things that other places have, except that we're going to have to make sure that we keep social distancing norms there as well. There's going to be lots of disinfectant available. You're going to be asked questions when you come in. Do you have COVID symptoms? Many of them may go ahead and scan you to check for a temperature. And so those are some of the things that's going to occur there. We're going to limit the number of people there, at least start out with probably a 25% of what the fire marshal says are allowed in the facility, excluding the employees. So we're going to open this up slowly, but we want people to get back to work. Absolutely, I want people to get back to working out. Let me just say that there is no other thing. There's no pill that I can give you that's as good as what we call the exercise prescription. And that exercise prescription is 150 minutes in a week. The easiest way to do that is 30 minutes a day, 5 days a week. So 30 minutes a day, 5 days a week at an exercise exertion level where you could talk, but you can't sing. Now, some of you may say that you can't sing, but it's about breath control. You're breathing hard enough and fast enough and that you're short of breath enough that you could carry on a very short staccato brief conversation in 3 or 4 words. Yes, no, oh, I think that's great. Or yeah, let's do this. But you don't have the breath control to carry a tune or to sing a song. That's the level of exertion that you need to be at. We call that the exercise prescription. It's good for your heart. It's good for your stress. It lowers your blood pressure. It lowers your heart rate. And again, there's no pill that I can give you that does all the benefits of an exercise prescription. Just be careful. We've been sedentary for a little while, for 58 days. So be careful. Don't overdo it. Certainly, if you have chest pain, stop, call your primary care physician and get a checkup. So keep doing everything that we're doing. We're doing a great job, Lubbock. Keep your social distancing, wash your hands, cover your cough, wear a face mask. That's my strong recommendation. Get out there and exercise, get some sunshine. Keep doing what you're doing, Lubbock. You're doing a great job. That's all I have. Lacey, it's back to you.
Thank you, Dr. Cook. And now we'll turn it over to Lubbock County Judge Curtis Parish.
Good morning, everyone. Thank you so much for allowing me the opportunity to join this news conference today. First of all, there's lots of thank yous that we need to pass out before we begin. I want to say thank you to Dr. Cook, to say thank you to Dr. Wells and Dr. Klepper for the job that they're doing, and the entire staff of the Lubbock Health Department and the yeoman's effort that they're doing in helping to track this virus, to work with those who are infected, to keep us informed as to what's going on. And I'll tell you, our thanks just can't be enough. I want to thank Mayor Pope, thank you and the city council members, Jared Atkinson, you and the entire city staff for all the work that you've done in making sure that we are well informed. As I listen to my colleagues around the state and as we share stories, I can assure you that Lubbock is the Cadillac of how to do this. And I think when this is over and the story is written about the response that the people have had to this COVID virus, they're going to look to Lubbock. How did Lubbock do this? And writing now the new protocols on how to deal with this virus based on how we're doing here in Lubbock. You can be proud to be a citizen of Lubbock and West Texas right now because of what we're doing to handle this. As we begin to get out in the community, I'm sure that you've noticed these Lubbock Safe decals on the doors of many businesses. Now, I've had the honor of delivering many of these to our county businesses whose protocols have been approved by the health department. Let me encourage you first that if you're a business that has not received one of these decals, please contact the city. And second, to all the shoppers out there, look for this decal as you shop. That means that this is a business that you can trust, that they're doing their job to make sure that you're safe when you come to their store. And also, they're keeping not just you safe, but they're dedicated to make sure that their employees are safe as well. It's a business worth shopping at when you see this decal. I want to talk about courthouse procedures. A lot of folks have called. First of all, they said, is the Lubbock County Courthouse closed? And just rest assured, we have been open the entire time. The Lubbock County Courthouse is not closed. We're still providing all the services and essential services that we need to the citizens of Lubbock County have still been provided during this crisis. But I do want to say over the next couple of weeks, the Lubbock County Courthouse will begin reopening many of our offices that have been either temporarily closed, doing virtual government. Many of our employees have been working from home, still providing services to the people of Lubbock County. But one aspect of our core functions here at Lubbock County are our courts. Now, as you know, we've suspended many of our court functions, including jury trials during this crisis. And we're currently putting in place now protocols so that when the governor and the Texas Supreme Court will allow us to conduct jury trials again, we'll have those policies and procedures in place to make sure that our citizens and our court personnel will follow the protection guidelines. Now, we're especially mindful of those who are the most vulnerable in our community and the caregivers of those who are most vulnerable. And we will make sure that those will still have access to our courts while providing accommodations to reduce the appearance of those individuals at our courthouse. Those protocols are currently being written. They will be put into place so that when it is time to resume full court activities, that we will have those in place. Now, our courtrooms are going to look a lot different. Our jury boxes are going to look a lot different. If you've served on a jury in Lubbock County over the past few years, things are going to look different in our courtrooms. But we are still committed to providing essential court services to the people of Lubbock County, and also to make sure that everybody stays safe during this crisis. I'm prayerful that we will come to a point where we can relax many of these social distancing guidelines. Maybe that will come sooner than later. As long as we kind of keep the curve flattened, I think that we will see many of those relaxed. But in the meantime, we need to stay diligent. And so part of what we're doing here at Lubbock County is making sure that we remain diligent in keeping the citizens safe, keeping our court personnel safe, and still providing those essential needs that we have here in Lubbock County. Again, I want to thank the mayor and thank the City of Lubbock Health Department for the opportunity to join this news conference. I know here later we're going to take some questions, and I'll be available to answer any questions you have about Lubbock County operations going forward over the next few weeks. So again, thank you very much. Lacey, I'll turn this back over to you.
Thank you, Judge. And now we'll turn it over to District 6 City Council Member Luttrell Joy. Ms. Joy.
Good morning to everyone, and I want to echo what Judge Parish has said about Kathryn Wells and Ron Cook. The health department is to be commended because they've been on investigative tracing from day one, and without that, we would not have the numbers that we have today. Also, I thank you to the Lubbock Police Department and to Lubbock Fire Rescue, who have helped us during these periods of quarantine that have been difficult at times. The nice thing about what we can do as citizens to help stop this COVID virus is that they don't cost money. Social distancing is easy. Sometimes it takes some patience. Hand washing is easy. Sanitizer whenever and wherever it's available. Face coverings. You know, there are people who object to that being a requirement, and I agree that is a personal decision. But remember that the person that you are standing by without a face covering may be someone's wife, mother, husband, child, grandmother, grandfather, or other family member who is in the high risk category. You can stay home. That doesn't cost you anything. In fact, for some of us, I think it saved us some money during this pandemic. Cooperate with those businesses as they reopen when they ask you for information or want you to fill out a questionnaire, and then check for those Lubbock Safe decals. Make sure that that business has done all of those protocols that are necessary to earn that decal. I think that COVID-19 and all the orders and the guidelines, they're personal to me and should be to all of us, whether you're infected or not. After the first order, my trip was to the grocery store a couple of weeks later. We couldn't visit with our kids. Mine lived here, didn't get to see them. But exercising and walking in my neighborhood helped to fill the time. And it was good for me. Those were personal decisions that people could make and should make. Dr. Cook has talked about exercising and getting out of the house. It's not good to stay in all the time. My yard looks better than it's ever looked because I took the opportunity to get outside and to stay at home. As these businesses open, we need to remember that you don't have to go shop. The businesses, some of them have not opened. They've chosen not to open for many reasons. But when you do go, just be aware of the possible exposure that you may have or you may give to someone else. I've said several times it's a personal decision to all of us, but hopefully we'll be responsible friends, neighbors, and coworkers, and recognize that there's a segment of the population who are vulnerable. And I'm one of those. You can be asymptomatic, but infected. So everyone that you come into contact with is a potential victim. We will make it through this, but unfortunately, some of our friends and neighbors will not, and have not. We have lost 50 of our citizens. Let's do our best to protect one another because it's the responsible thing to do. If we do the recommendations and follow the guidelines, we can get everyone back to work, and we can get them back to work safely. Thank you. And now I'm going to hand off to Mayor Pope.
Thanks, Ms. Joy. Luttrell, we appreciate you and Judge Parish being with us this morning, and for your both your heartfelt encouragement and updates with information. So I'm going to share my screen. I'm going to start with data this morning, as this become my practice. Okay, and let me go back to the very beginning. I'm sorry, I didn't start at the right spot. Okay, so 9 quick slides. Reminder that this information is available on our website at the city of mylubbock.us. Click on the coronavirus tab to get to the health department. And so the demographic data, we start with 5 slides that are demographic data, and then some geographic data about where people live that have contracted coronavirus. Okay, then there's 4 slides that we're really watching, and I want to pause and go through these. So active cases by day. So active cases is total cases less recovered and deceased. This is the trend line here remains very, very positive. Now I know you're watching this on our website because I got a question about this. In fact, we corrected one of our slides yesterday based upon one of your questions. So thank you for continuing to check this data. It's updated every afternoon late. New cases by day. So we remain, we've not had over 10 new cases on any day this month. So that's very positive. Hospital data, our hospitals remain strong. You can see this information. We had, I believe, yesterday we had 16 hospitalized COVID-19 patients in our Lubbock hospitals. That's very positive. If you contrast that to Amarillo yesterday, they had 77. So they're in a different place than we are with more in their hospitals. Now they still have capacity. They're not stressed, but we're in a very good spot, and that makes us feel good about opening. Finally, our test data overlaid with new cases by day. If you paid attention, you know that we reported more than 600 new tests yesterday. Now, testing data, sometimes it has to do with when we get it from the lab, so it's not perfect, but the trend line on number of tests is very positive. We want to test people, and we want to understand the positives per test. And so, you know, and that's very, you see the red line, the bottom line, and you see how it's continues to be as positives as a percentage of tests continue to go down. So good information there. Okay, I believe I'm back now. And we want to talk about Lubbock Safe. Judge Parish mentioned that. We have 650 businesses that are now Lubbock Safe certified. The guidance regarding gyms went up this morning. Dr. Cook talked about gyms, and our gym owners and operators can self-certify. The dance studios, I feel like, would be in that category. They will open on Monday also. If you'll certify, we'll deliver your stickers and we'll get you added to our website. I want to pause, and much like Ms. Joy, I want to make sure that we always remember our frontline workers and their families, the families who have experienced deaths and have been very much impacted by COVID-19, and our individuals who have lost jobs and businesses that are struggling. You remain in our thoughts, and our efforts to recover are held with you in mind. We want the very best science and information. We need safe environments for workers, for us as we go back into our stores and our restaurants. And we deserve the personal freedom that we cherish as Americans. We're on the right path to recovery, I believe. I want you to always remember that as we recover, we're going to have to summon that West Texas spirit. Each of us and our neighbors together, turning loose that energy and ingenuity and those great ideas. We can reopen, and we can do it safely together. On Monday of next week, we will make an announcement about our public press conferences. Several of you have asked about what our cadence will be. We'd like to see what happens through the weekend before we let you know, but you very well could expect us to change the frequency. We also know that Governor Abbott is at least rumored, it's not been confirmed yet to my knowledge, but that he will be speaking on Monday about the next step in reopening our state. And we look forward to embracing that and being ready to comment on that next week. Lacey, that concludes my comments.
Thank you, Mayor. And now we're going to open it up for media questions. And for this portion, we're going to welcome Dr. Johansson Cordero to the panelists. And today's media order is Christy Martinez Garcia with Latino Lubbock, Karen McKay with KCBD, Brady King, Fox 34, Jonathan Seaborn, Texas Tech University Public Media, Terry Furman with KLBK, Olga Aguero, El Editor, Matt Dotre, Avalanche Journal, and Matthew Stell with KMAC. So let's start things off with Christy Martinez Garcia.
Good afternoon, everybody. I'm Christy with Latino Lubbock Magazine. Dr. Cook, this is probably for you, and I'd like to see if Dr. Cordero can also respond in Spanish, por favor. As concerns grow about pediatric multi-system inflammatory syndrome, a rare illness that strikes children and is believed to be linked to the coronavirus, should families be planning for summer camps and normal activities, and what should they do to protect their children?
Thank you, Christy. You know, this is a new disease that we're starting to see as, we initially kind of thought kiddos were immune to this or didn't respond near to the extent that adults did. And so this makes us exceedingly nervous that when parents of small children, this disease can be fairly significant. You know, there are kiddos that will do well, and there are children that will get exceedingly sick. And so it does present different than adults. And so it presents with rashes and certain kinds of fevers and certain kinds of other skin findings, and it may affect other their organs a little bit different than our organs. We're seeing it more so in these kiddos than what we initially expected. And so how do we treat that? Well, it's still supportive care, just like what we do with adults. But certainly telling our parents that if these kiddos show up with these funny rashes or funny skin manifestations, it's called COVID toe is a euphemism. It's funny little looking toes that get purpley or red, and it may point to some underlying inflammatory disease. How do we treat it? We treat it just like anybody else. If you've got your child out, make sure that you keep them away and keeping that social distance only within family units. You certainly can't let your 2-year-old run off, but certainly keep them in close family units. And as far as summer camps go, it is a concern on how different camps may have set up. I would certainly inquire about how, if they do have camps later on in the summer, how they plan to maintain social distancing and hygiene in those places. Those are all great questions that we don't quite know the answers to yet. Dr. Cordero, I'll leave it with you.
En español, la situación que estamos mirando con este diagnóstico pediatra que está afectando a los niños, los afecta de diferente manera que a los adultos. Los niños van a tener cambios en la piel, van a tener fiebre, van a tener tos. La forma que los tratamos, pues sinceramente no tenemos que tratarlo solamente soportándolos, dándole medicamentos para la fiebre y el dolor. pero básicamente en este momento no tenemos ningún otro tratamiento. Según empezamos los niños que están empezando a pensar a tener el campamento durante el verano, es algo que tenemos que tener mucho cuidado. Tenemos que investigar si los campamentos van a tener forma de mantener la situación, los niños distanciados uno del otro, si van a tener la oportunidad de tratar unos con el otro. No tenemos la contestación ahora mismo, no tenemos la respuesta que tenemos. Así que sinceramente digo que los padres tienen que tener mucho cuidado si tienden a pensar mandar a sus niños al campamento. Espero que eso los puedan ayudar. Gracias.
Gracias a usted. Councilwoman Joy, my next question is for you. I appreciate your message and how but what I want to know is, how do you feel when some of your colleagues are asking the public to do something, but they do not lead by example, specifically in relation to face masks? I mean, how confident do you believe that the citizens can be when those folks that do the opposite of what is being asked of them, because as you said, it's the responsible thing to do, isn't being done?
Christy, thank you for that question and comment. I am a firm believer that if we are going to recommend and have guidelines, that we as council people must follow those. I'm sitting here with my mask around my neck, and one reason is because I can get it up in a hurry. I don't have to reach across the seat in my car, and I wear it when I am out. I think that we should all be adhering to our recommendations and guidelines.
Okay, thank you, Christy. And now we have Karen McKay with KCBD.
My question is, even though the governor has not allowed it yet, the bars and nightclubs are planning to open on Monday. So your thoughts about that, your concerns, and how will the city respond? Will there be fines if they do so?
Yeah, so Karen, I was not aware that they were planning on opening on Monday. That would be, to my knowledge, that would be in conflict with what the governor has laid out for the entire state. And so I guess we would work with our bar owners individually and talk to them about their plans.
Also, every day we give all of your numbers on the air. And yesterday we said, as you have also mentioned, Kathryn, there was about 600 tests given yesterday and only 2 new cases. Do you think that gives people at home a false sense of security now, or does that signal, yes, we're over the worst of it and it's time to reopen? Time to go back to normalcy. What do you think?
I think we need to make sure we keep our testing numbers up, because there's still a possibility of getting small outbreaks throughout the community. We are really looking for new pockets of disease. And if we find any new cases, we're going to go in and do those contact investigations, just like we've been doing. And we've shown that doing those investigations has really flattened our curve here locally.
Okay, thank you, Karen. Now we have Brady King with Fox 34.
Hi, everyone. Thank you. My question is for Ms. Wells. I believe the governor announced the National Guard will do disinfecting at nursing homes. Do you expect that at any nursing homes here?
I spoke briefly with Texas Health and Human Services here locally, and my understanding is that disinfection in the nursing homes will be done in places where there are outbreaks. And that can be done at the request of the local health authority or the nursing home themselves. I don't know of any plans here in Lubbock to do that currently.
Okay, thank you. That's all I have.
Thanks, Brady.
Thank you, Brady. Next, we have Jonathan Seaborn, Texas Tech University Public Media.
Good morning or good afternoon, and thank you. I'm curious, with the reporting structure set up the way it is for the Lubbock Safe program, has the city received any citizen complaints on any of those businesses for not following the voluntary guidelines? And if so, how does the city follow up on that?
Yeah, it's a good question, Jonathan. We, if someone has a concern about a business that is a Lubbock Safe business and you don't feel like they're following the protocol or what they've self-certified, then we ask you to call our call 311 or call the non-emergency line at Lubbock PD, and we'll send someone out. We have a group of people, our fire marshals and a number of other city employees that are working with our Lubbock Safe businesses that are doing drop-bys just to check in on them, make sure they don't have any questions. But we've had remarkable compliance. I don't know of the numbers of complaints we've had, but I would say a handful or less. The folks that have certified as Lubbock Safe are taking it very seriously. In fact, I was at had a conversation yesterday with a business owner about how many comments he had received from people who come in his business about his Lubbock Safe certification, the sign on his door.
And Mayor, we might add to that even if they are not a part of Lubbock Safe, we do have citizens who report the failure to social distance and to follow guidelines as well.
Good point. Thank you, Ms. Joy.
Thank you.
Thanks, Jonathan.
Okay, next we have Terry Furman with KOBK.
Good morning, everyone. My question is this: with tech students coming back on campus and them possibly not doing a situation where people have roommates, are we looking at an influx of people living off campus, and are we prepared for that, I guess, as a city?
Yeah, so Terry, that's a good question. The planning around the fall for colleges around the country, including Texas Tech and Lubbock Christian, Wayland Baptist, South Plains College, that planning is still underway. When I talked to leadership at Texas Tech late last week, they have a number of contingency plans. I know that our Lubbock Economic Recovery Task Force Education Subcommittee is involved in this planning. They've met with those leaders. Some of those leaders are on their subcommittees, and that work will continue. Ms. Joy, I know you're on alert. You might want to add to this, but I don't think anyone has concrete protocols in place yet.
No, I would agree. That is something that we'll have to develop here probably in the next 30 days. I think we will see something more specific from Texas Tech. They have revealed slowly their plans, and I don't think the plans for semester 2 summer are complete yet. So everybody needs to stay tuned and see what's happening. We need our students back. We want them back, but we want them back healthy.
That's right.
All right, very good. Thank you all so much.
Thank you, Terry. Now we have Olga Aguero with El Editor.
Good afternoon, everybody. I guess maybe the doctors can answer this question, maybe Kathryn, because it's like a two-part question. Would you be able to tell us the accuracy rate for the test being administered here in Lubbock for COVID-19? As I understand, there are many tests available with inaccurate false negatives being given. And I would like to know the percentage to expect here in Lubbock.
Kathryn, I can start on that. Thank you, Olga. You know, there's a number of different tests. I know the ones that the hospitals are using are as best that we can get, and they have been approved by the FDA. Each test, there's no test that's 100% accurate. And so there's going to be false negatives, and then there's going to be false positives. And it's a fine line between having enough of those to make a good test. The ones that UMC and Covenant are using are the best, and the FDA approved that we have available to us at the moment. As time goes along, those tests will become more accurate, et cetera. So those are the ones that we're using right now. Dr. Cordero.
En español.
Sí, gracias.
Lo que estamos viendo es que ahora mismo no hay ningún examen que es 100% correcto. Todavía nos da positivos falsos o positivos negativos. Y por eso los mejores exámenes que tenemos ahora están siendo por el UMC o Covenant. Y con todo eso no son 100%. Así que les recomiendo que si necesitan algún examencito, que lo den en UMC o Covenant.
Exacto, gracias. Okay. As for testing, all the way I understood of Governor Abbott was he had indicated that he would want all nursing homes, all workers, to be tested. And where is Lubbock with this? And if we haven't gotten to all the nursing homes, when are we going to be expecting results on these entities?
I'll go ahead and take that. There was guidance issued by the governor, I believe it was late last week, indicating that they wanted all nursing homes across the state of Texas to be tested. We're still waiting on guidance from Texas Health and Human Services, and also with our part of the goal is to have the fire department help us with this testing. We don't have the guidance or the testing supplies yet to follow through with this initiative.
Okay, thank you, Olga. Now move on to Matt Dotre with the Lubbock Avalanche Journal.
Thanks, Lacey. Hey, everyone. Ms. Wells, have you gotten any results back from the antibody testing? And can you talk a bit about what you've seen?
We've received just a handful results from the antibody testing. The majority of those individuals we've been able to tie back to either a contact with a case or someone that would have been likely to possibly have been exposed, such as a healthcare worker. We have not released the actual counts of those antibody tests yet. The state still hasn't given me firm guidance on how that should be reported.
Okay. Okay. Well, and can you talk a bit about testing? So it seems like places are starting to roll back testing. If Covenant is stopping the drive-through clinics and Walmart is reducing hours to 3 days a week for a couple hours really early in the morning, like, does that make you, can you kind of explain why they're rolling back testing, and if that makes you nervous at all? Because it seems like they should be trying to increase testing right now.
Well, I think we're changing where people are getting tested. So with, we're seeing more and more doctors' offices and community clinics starting to have access to testing where they can give testing at the point of care. So we're seeing less of a need for operating 4 large drive-throughs throughout Lubbock. The health department's committed to keeping our drive-through going because I really want to make sure that we have access to individuals who either don't have health insurance or don't have the money to pay to go into the doctor's office. I want to make sure we always have that free option here in Lubbock.
Thank you, Matt. Now we're going to, oh, sorry, Mayor.
I just want to add on to that, Matt, testing continues to be very, very important. And it will be important as we go through the summer and into the fall. And so our messaging around testing is in no way to lessen how critical it is. And we're so thankful that we have partners like Covenant and UMC and Walmart to supplement what's going on at our health department with testing. And we're very fortunate. We continue to test it just nearly twice the average of the rest of the state. And that's a big part of, I believe, why our city is safe.
I have a question for Kathryn about the antibody testing. Kathryn, do they disclose the results to the person who had the testing done?
Yes, so the test results are given to the patient first, but that antibody testing is reportable to the public health department through guidance from the Department of State Health Services.
And so the question is whether or not you all are allowed to release that information.
I'm just not sure how we are supposed to categorize an antibody test. Is that a case, a probable case? We're still waiting for that guidance on how to count it and what information needs to go up to the state.
Thank you.
For the listeners, Dr. Cook, this is for the listeners, what that means, the antibody test The current antibody test, which is an IgG test, shows up 2 to 3 weeks after the infection, so the person may be completely recovered. And so 2 to 3 weeks out, as far as contact tracing, is going to be much more difficult if you have somebody that's symptomatic, goes in and has a nasal swab, and we know within 15 or 20 minutes or 48 hours, it's easier to trace back a history and find out how they got it. But 2 to 3 weeks out is going to be exceedingly difficult to try to find who all they were in contact with, the 3 weeks provider. Many of us can't remember what we had for breakfast, much less who we were in contact with 3 weeks ago. So that's what we're waiting on guidance from the state. What column do we put this in, and how do we chase that down? That's the guidance we're waiting on from the state. Dr. Cordero, you might want to answer that for our Spanish-speaking population.
Cuando hacemos el examen para los inmunoglobitos, además del swab de la nariz, todavía los resultados que vemos ocurren como 3 o 4 semanas después que la persona tuvo la infección. Y el problema que tenemos, pues, que entonces no podemos saber de dónde vino la infección. La gente no se da cuenta. Mucha gente no se recuerda qué comieron para desayuno. Entonces no se van a acordar de qué personas fueron expuestas a eso. Así que todavía no tenemos resultados finales en cómo podemos aplicar el resultado de los inmunoglobulitos en el examen de esta infección.
Thank you.
Okay, and our last media question is from Matthew Stell of KMAC.
Thanks so much, Lacey. I've got 2 quick questions. My first question is, of course, we know Lubbock is known for having some big summer events such as the Ironman competition and also 4th on Broadway. I know we spoke about 4th on Broadway, I believe, about 2 weeks ago, but just kind of want to get a update on those events. Are they still planning on going on? And what are some of the steps the city is going to take to make sure people are safe if those events do take place?
Yeah, great question, Matthew. It's so I think we talked earlier this week about 4th on Broadway, and I expect a formal announcement on that very soon. But the planners of that event, I think, will most likely move that later in the year, hopefully later in the summer. We continue to have conversations with people that put on other very important events in our community in the summer. Good, examples. I had a conversation yesterday with one of the organizers of Juneteenth celebration, and so I would imagine you would hear a word from them soon on their plans. The Ironman, we've had conversations I think as recent as early this week with the organizers of that event, and we'll have more updates to come. We feel like that's one that, because of the fact that there is a potential to distance the competitors, we feel like there is a chance that might still happen. But even though that's the very end of June, that's a long way away in the world we live in today.
Mayor,
gotcha.
If I may, here at the Lubbock County Courthouse on Wednesdays during the summer, we have a high noon concerts. They're at the gazebo. We set out chairs, and people just enjoy kind of being outside, enjoy their lunch, and enjoy a live concert on the courthouse grounds. We are at this point today planning to continue that. We've set the schedule for this summer. Now, we are fortunate because we have a very large area here that we can socially distance. We can spread people out. So that people are not congregating close by with each other, and still being able to enjoy being outside, still being able to enjoy the live music presentations. So these are events that we hope that will happen throughout the community. These smaller, maybe more intimate events, but in venues that will allow people to kind of spread out a little bit. In order to maintain that social distancing protocols that we're setting in place. But that's one aspect that we're already in the planning stages of continuing to go forward this summer here at the courthouse lawn.
Thank you, Judge. Thank you, Mayor, for that question. I've got one last question. Is there any, I guess, concern about Texas Tech students, and that won't be limited to also LCU students, who may be not from Texas, from across the country, possibly New York and California, and them coming back to school later this year, possibly in August? Is there any concern about those students coming back, especially if they're coming from possible hotspots?
Yeah, I think there's certainly a concern. I would imagine that's part of the precautions and protocol that Texas Tech will put in place, Lubbock Christian will put in place as they bring their students back. My guess is to like businesses that are restarting and reopening office buildings, there's a lot of antibody testing going on with those folks, or even the screening that has become part of our life. Not only the temperature check, but the questions and the panel of questions that have to be asked. Remember, once again, today's May the 14th. I think the earliest anybody would come back to for class would be the second summer session. So we're 60 days away from that roughly. We have some time to get those answers, and I promise you we will do that. Those decisions will be made by people with safety as the very top priority.
And Matthew, I might add, we will also have students who are abroad at homes with their families who will be returning as well. So I'm sure all of that's going to be taken into consideration, and because we want them to be protected when they get here, as well as protecting our citizens when they come back.
Okay, that concludes our news conference, unless our panelists have anything y'all would like to add. Okay, thank you to our panelists, thank you to our interpreters, and thank you all for joining us. We'll see you back here next week.
Thank you.